Hello everybody, welcome to Nursesladder. Today in this video, I'm going to share some of my ideas regarding the way how you should approach a question which is related to a nursing subjects, especially or specifically related to medical surgical nursing or pediatric nursing. In this video, I will make you understand how to organize your answers or how to put the headings or titles of your answer, specifically long essay or short essay, in an order so that your answer would be clear and concise when an evaluator read it. Since this channel has a wide range of viewers, that means it ranges from the nursing aspirants, especially those people who want to take nursing as a course. Another group would be students studying in various nursing courses, and another set of group of people could be those nurses who are registered and who want to get a better job. So all of you are welcome to this particular video, and this video is specifically meant for all those nursing students who want to give a proper answer, a defined answer to a particular question. So my dear friends, let's move into the video. The topic on which I'm going to talk in this video would be how to give or provide an answer for a question which is related to disease conditions of particular organ. In this regard, the first heading would be introduction. In introduction, what are you supposed to write? You are supposed to write regarding the details of the organ which is related to the disease condition. For example, you are getting a question related to appendicitis. Short essay, you may simply get a question, appendicitis, and that will be of 5 marks. Then how are you supposed to write the answer? In this condition, first of all, you are supposed to give introduction. Introduction, you will write all about organ, and you will write it very specifically. You are not going to write a whole paragraph about introduction. You will just specify what is this organ. In this, first you are supposed to write about the location of the organ. So here the first point you will include the location of the organ. As I said before, if you're going to write about appendicitis, you're supposed to write, or you can even draw the picture of quadrants of abdomen. As we all know, there are 9 regions of abdomen, as well as there are 4 quadrants of abdomen. So there is a left upper quadrant, left lower quadrant, right upper quadrant and right lower quadrant. And appendix is located in the right lower quadrant. So you can draw a diagram like this, which indicates the location of appendix. So the location of appendix would be in this particular portion. And appendix is located near to cecum, which is a part of large intestine, and specifically ascending colon, this part, and it is near to ileocecal valve. And even you can include the function of appendix. So this is just an example about what I said is just an example. You can even apply this with any other organs or organ system. Okay, I hope you understood about this, and even you can include that this appendix is located, or that particular organ is located in this part of the body or this region of the body. Like for example, in this case it would be right lower quadrant. The second heading which you would include would be definition. Here you are supposed to define the disease condition. Here also, in order to make it clear, you can include the author details with year. If you are very much interested to get more marks, or it is very good to include year and other details, because many times there will be lot of definitions which is given in the textbooks. So if you can remember, you can better include the author who has formulated this definition, as well as the year in which this definition was published. The third heading on which I'm going to talk is epidemiology. In epidemiology, you are supposed to include the statistical data which is related to a particular disease condition. That means, very specifically, it includes incidence, prevalence, as well as mortality rates all over the world which is related to that particular disease conditions. Many times mortality rates may not be included, but you can include the incidence and prevalence rate of the particular disease condition. I hope you already know about what is incidence and what is prevalence. Incidence means it's the number of new cases which have been identified, and prevalence is the number of new as well as old cases of disease conditions in a particular geographical area. So this is all about the epidemiology. Even you can also include the gender, because some disease conditions could be more seen in males, some could be very much seen in females. So even that data also you can include if it applies to this particular condition. The fourth heading is etiology. What is etiology? Etiology is a list of causes of a particular disease condition. So what are the causes, or what causes this disease condition to occur? So that particular factors you will include when you are going to write about the etiology of a disease condition. In case of appendicitis, the etiology could be that of fecalith, obstructions or blockage. So like this, you are supposed to include the etiology of this particular disease condition. It may vary from different disease conditions. The fifth heading would be risk factors. So in many of the disease conditions, there are certain risk factors which increases or which put the patient into risk to have a particular disease conditions. Like for example, smoking is a risk factor for COPD, emphysema, asthma. So these all are different disease condition, but the risk factor is smoking. Hypertension as well as obesity are risk, even hyperlipidemia are risk factors for cardiovascular diseases. So, if you are going to write the risk factor for a cardiovascular disease, you can include that of obesity, hyperlipidemia, and even hypertension. It is not mandatory that all the disease conditions may have types. So you need to understand it depends on each disease condition. So you are supposed to make it clear whether that particular disease condition has types or not. Types could be like acute, chronic in some conditions, as well as like in case of hepatitis, it would be divided like hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. So it is divided into many types. So you can include the types if the disease condition has types. Otherwise, you can leave that heading. The seventh heading would be pathophysiology. This is one of the most important heading which an evaluator check thoroughly. If you are not much clear about pathophysiology, you are going to lose mark in that particular topic. You are supposed to know very well, or you are supposed to have a basic idea about how a disease condition occurs. So in pathophysiology, you are going to give a clear-cut idea about how a disease condition occurs from etiological factors till clinical signs and symptoms. So when you are supposed to start giving a pathophysiology, the first and foremost heading or the point which you will include would be due to etiological factors. This is a basic point, like the basic title which you should start from. Because etiological factors are the factors by which a disease condition starts. So you can even mention examples. Near to this etiological factor, you can mention one or two examples that will make it clear. And you can progress further. So what is the mechanism which is happening after that until it reaches the clinical signs and symptoms. So at last you can even include the clinical signs and symptoms. There will be many mechanisms which happens, and at last it will result in the clinical features. Another heading would be clinical manifestations. So these are the signs and symptoms which you can elicit from a patient. These signs and symptoms could be that of subjective as well as objective. That means what the patient say as well as what you are going to observe in a patient. So the clinical features you can better mention as the general clinical features as well as the specific ones. So you can make it like, you can categorize in these three divisions. So general features means the basic features which you can find in a patient who is suffering from a particular disease, the common features. But specific features will be there, that is the classical features. Without that you cannot imagine about that particular disease condition. Like in case of appendicitis, there is a rebound tenderness. Even there is a Rovsin sign, McBurney's point, which is involved in this particular disease condition. I would like to give another example. If you're going to write about meningitis, classical features of meningitis would be Brudzinski's sign, Koenig's sign, and even knuckle rigidity. So these signs are very common, and you cannot find a patient without these signs. Means these are very classical. So that's all about the specific features you can specifically mention. Other than that, even system wise also you can order it, like the symptoms which are related to autonomic nervous system, the symptoms which are related to gastrointestinal system, the symptoms which are related to cardiovascular system. Okay, so like this you can divide it based on different systems. The ninth heading would be diagnostic evaluation. In this heading, you are going to prioritize, or you're going to make it order all of those diagnostic evaluations or tests which are going to be performed on the patient who is suffering from a disease condition. So you can include the different diagnostic modalities or interventions in these headings. So, in this case, you can include hematology, microbiology, biochemistry, and radiology. So, if you are able to recognize the different tests which are related to these specific areas, then it is well and good. If you are not able to do that, if you are not able to categorize it, it is okay, no issues. But if you can do it in this way, you can order it, then it would be best. Okay, so like hematological investigations, which are those hematological investigations? So it could be related to complete blood count. Complete blood count is a particular investigation or test which is related to hematology. One could be that of microbiology. It could be all those bacterial cultures. Okay, the cultures, like we say stool culture, urine culture, all of these are related to microbiology. Then other than that, there is something which is related to biochemistry. So it could be related to that of taking out the different electrolytes like calcium, potassium, sodium. So in order to find the values of these, okay, specific electrolytes, minerals, or you can say enzymes, okay, all of these could be that of biochemistry. And the last one is radiology. So radiological investigations could be that of MRI, CT scan, X-ray, ultrasonography, or some other form of radiological investigations. So I hope you are understanding how you can organize the different subheadings related to diagnostic evaluations. The next heading is treatment or management. So this is one of the very important heading which you are not supposed to omit at any cost. So this heading has many divisions. The first one would be pharmacological, the second would be medical, then surgical, and the last one would be nursing management. So in pharmacological management, you are supposed to include the category of drugs or medicines which you are supposed to administer for that particular patient who is suffering from that disease condition. So that's all about pharmacological. Like for example, antibiotics, analgesics, antipyretics, anti-inflammatory. So like that, the group of drugs with examples you are supposed to provide in this particular heading. Then the second one is medical management. So in medical management, you are supposed to include the general medical intervention, insertion of IV cannula, starting IV fluids, measuring of intake output, as well as you can also include like assessment of vital signs. So all of these could be part of general medical management. The next one is surgical management. So in case of surgical management, you should include the type of surgery which will be performed on the patient. So it could be either elective or emergency. Elective is a surgery which is planned before itself. So it will be arranged before itself, the date will be planned before itself, based on that surgery will be performed. If you take emergency surgery, depending upon the patient's condition, if it is an emergency case, you need to perform the surgery fast so as to save the life of the patient and to avoid complications. So it depends on that. So in the same condition itself, sometime you have to perform the surgery in form of emergency surgery. Like for example, in case of appendicitis, if there is a rupture of the appendicitis, like the appendix gets ruptured, okay, then the infection is going to get more, the patient's condition can become complicated, the patient's life can become endangered. In this condition, we cannot plan for an elective surgery. We have to go for emergency surgery. So depending upon the condition or the disease condition itself, there could be many varieties of surgeries, or the surgery could be divided in this way, and even there are closed surgeries and open surgeries like laparotomy as well as laparoscopy. So you should be able to identify which type of surgery is performed in like which case. So that's all about surgical management. So in one disease condition itself, there could be 3 or 4 types of surgeries. Another management is nursing management. So as a nurse, this is one of the important management which you need to know. So in this case, how you are going to write or provide an answer for this question? Nursing management, first of all, you are supposed to list down the nursing diagnosis. So you are supposed to list down the nursing diagnosis. So how you are going to list down the nursing diagnosis? See, before itself we know that the patient has a number of like a list of clinical signs and symptoms. So based on that, you are supposed to make your nursing diagnosis and as well as nursing care plan. So you already know what are the clinical signs and symptoms or clinical manifestations or clinical features which are present in one particular disease condition. So on that basis only you are supposed to make the nursing care plan as well as nursing diagnosis. As we all know, we can make nursing diagnosis based on Nanda nursing diagnosis, which is globally accepted. And here we are supposed to understand that when you are going to list down, specifically you are supposed to list down minimum 7 or 8 nursing diagnoses. In this, you will give priority priority. Okay, priority for some particular nursing diagnosis which will put at the first like 2-3 numbers. Then again, depending upon the like the priority wise, you will list it down. Okay, so that's all about like acute pain, hypothermia or impaired thermal regulation. So these type of nursing diagnosis comes in the first order. So you are supposed to prioritize the nursing diagnosis depending upon the type of complaint the patient has. So in this condition also you can do it based on the clinical signs and symptoms of the particular disease condition. The another heading which comes under nursing diagnosis is nursing process. So nursing process is also referred to as nursing care plan. So in nursing care plan, what could be the main headings? So let's see that. In nursing process, the first heading would be assessment. So assessment includes both subjective data as well as objective data. Subjective data is the data or assessment which you collect when a patient states his or her complaints. Okay, so that is subjective data which is given by the patient, and objective data is the data which you will find out through the signs which the patient you will get by observation. Okay, so objective data is the data which you collect by means of your observations of the signs which the patient shows, and subjective data is the data which you will collect from the patient as the patient states them or complains them. That's all about the assessment. Then the second heading is a nursing diagnosis. So this nursing diagnosis will be formulated based on the assessment. As I said before, you will assess and you will get your subjective and objective data. Based on that, you will formulate the nursing diagnosis. And each nursing diagnosis has 3 parts. Okay, nursing diagnosis always has a 3 parts or 3 components. Then other than that, you will go for goal. You will plan your goal. Goal is the objective of your care. So you will write the goal, like you are going to provide this particular intervention in order to. So what could be the outcome which you can expect later after providing the intervention? That will be your goal. Then the next one would be planning. So plan of care. Okay, so based on your plan only you are going to implement the care. So before itself you are going to plan, like you are going what all interventions you are going to do, that you will include in the plan of care. Implementation means what you are going to do for the patient. So that would be almost related to planning, but whatever you are going to plan, when you are going to implement it, you are supposed to include all those findings which you are supposed to get while you are going to implement the plan. Then evaluation. Evaluation is almost related to goal. In goal, we will write everything in future tense, but in evaluation, we will not write it in future, but you will write it in present tense. So that is what the difference between that. So evaluation means it is the outcome of the patient. That means how much of care you have provided and what was the result of that care. So that you will write in the evaluation. Okay, so I hope you understood about how to plan a nursing process. My dear friends, if at all, if you have doubts, if you want a specific video on nursing care plan or nursing process, you can put it in the comment section so that I can make a separate video for that, because it's the lengthy one. Okay, I need one full video for explaining on nursing care plan. So if you really want that kind of information, then you can put it in the comment section. So this is all about nursing process. So when you're going to write or provide an answer for an essay or short essay, in that condition, you can make it brief. Okay, you can make it brief. You can concentrate more on nursing diagnosis as well as assessment, and the main focus you can include on planning. Main focus you can include on planning or interventions. Okay, planning is also referred to as interventions. That is not as implementation. Implementation is different. So that you can give more focus, and you can give focus for the first like 4 parts you can focus more in your nursing process, which you will write in your theory exam. When it comes in practical exam, then all of these parts will be more focused. Okay, why? Because here you don't have a real patient. You are going to give a plan of your nursing care plan. That is why the reason why I said you can focus more on the 4 main headings. But you can even include all the 6 headings in your answer. So you have to draw, and you have to make a like column wise you are supposed to write, or you have to make nursing care plan column wise, even if you are writing for a theory exam. Okay, so I hope you understood how to make a nursing care plan. So you are supposed to make at least 3 nursing care plans in case you are writing for a theory exam. If you are writing for practical exam, you can make at least 5 nursing care plan. That would be best if you are able to make. Otherwise, if you are writing, you are going to provide answer for theory exam, like as I am planning for this video, you can make 3 nursing care plan, and you can make nursing diagnosis. You can prioritize nursing diagnosis at least 7. So 7 plus 3, 10. So if you have any doubts, please put it in the comment section. So this is all about today's video. I hope you got some idea about how to provide a good answer for short essays, specifically for short essays on different disease conditions which are related to medical surgical nursing or pediatric nursing. And if you have any doubts regarding any such headings, if at all, if you have, you can mention it in the comment box so that I can reply you back. So that's for today, my dear viewers and subscribers. If there is anyone who is new to this channel, you can better subscribe to my channel to get information on nursing courses, admissions, nursing career or jobs, job applications, or even you can subscribe to my channel for getting informations related to the latest updates on nursing profession in India. So that's all for today, my dear viewers and subscribers. I hope you all are fine. Thanks for watching this video. Take care and bye.